Health Education Lecture Series. All the listeners of Health Education Lecture Series, I'm your host Gurdeep Singh Sandhu, homeopathic consultant, and I'm here at 9701 Sarah and Court, Dublin, California 94568, and phone number 408-687-1899. Email address homeomedicine, HOMEOMEDICINE सो आज का ये लेक्चर हिंदी में लेक्चर है, हिंदी का समय है आज का. सो मैं समझता हूँ कल पंजाबी में हुआ था, तो आज इंग्लिश में होगा और कल हिंदी में होगा. आज का इंग्लिश का प्रोग्राम होगा. सो वी आर डिस्कसिंग अबाउट द external changes produced by the internal damages in all the organs in chest, because we have already covered the area of head, neck, and now we are at the area of chest, and we have already described what are the organs in the chest, so that if ever anything happens outwardly which is not normal, every day you see your eyes, every day you see your nose, every day you see your lips, forehead, skin, nails, hands, and everything. But if ever in all these things which are visible outwardly, if you see any change which was not previously, it is indicating that something has happened inside your body. Something has happened inside your body. There are many more organs from head to heel, many organs, but we are localizing our research and our symptoms to a particular area. Just like the particular area of head has been discussed, the particular area of uh, neck has been discussed, and also now we are at the thorax area. And in this thorax area, the main important organs are heart, lungs, mediastinum. And the mediastinum uh, is a pathway from head to downward, uh, which allows many organs, many blood vessels to pass from upward to downward and from downward to upward, so that a connection be maintained between the upper head and upper organs, and connection be maintained with the lower organs of the body, just like the chest and the abdomen, so that a connection be maintained and they can give and take substances, give and take reactions, give and take all the things through this pathway. And this pathway has many important organs. Just like I told you, the heart is the main important organ which is separated from the lungs. The lungs are two big organs inside the chest. These are the two big organs inside the chest. One is right lung, and the other is the left lung. These two, and both the lungs are having their different description, because they are not equal and they are not similar. Left lung has two lobes, right lung has three lobes, and all the lungs, both the lungs are covered by a membrane that is known as pleura. And that pleura, the internal layer of the pleura, that is known as the visceral layer which is attached with the lung substance itself. And just like we are wearing something undershirt, so something undershirt is connected with our internal organs, uh, body organs, whereas the shirt is outwardly. In the same way, the internal layer that is known as visceral layer goes in between the lobes, because lobes are the separate boundaries. Lobes are having their separate boundaries, the upper lobe and the lower lobe. And the upper lobe and lower lobe, they have a section in between that boundaries, and between the boundaries, this visceral layers enter into it. And between the visceral layer and the outer layer, that is known as the parietal layer, that parietal layer, there remains a fluid inside that one. And in that fluid facilitates the movement of the lungs. And there should not be any friction normally between the two layers of the lungs, though it is not connected with the lungs, it is above the lungs. Two layers are above the lungs, but one is attached to the lung substance and the other is attached to the outer boundary wall of the chest. And they are having very close contact, and within that there is a some type of liquid which facilitates the movements of the lungs. Movements are lungs are constricting, lungs are dilating, lungs are constricting with every respiration, expiration and inspirations. And in this way they are making facility for the lungs, and we do not feel any problems if there be a normal fluid and these layers are separated from each other. And when you will discuss about the diseases of the lungs and all that, you will see the first thing from outward inward. We have discussed about the ribs, we have discussed about the boundaries of the chest bone, bony structure of the chest wall, and in between structure the intercostal muscles and all that, cartilages and all that. We have already discussed all these things in our previous lectures. But here, uh, when there is any change in this fluid which is just above the lungs, in between the two coverings, it causes pain, more or less. If it's less, even then it causes pain, just like the dry pleurisy, frictions. If it's more, even then that's called wet pleurisy, and there are many more other conditions which we can diagnose later on. But here we are discussing about the other organs, that are the lungs. Particularly the lung substance, the lung anatomy or description. Lungs are made up like the bee, you can say the bugs of that bee. You have already seen that there are small, small holes in that one, and where they put their excretion, that is known as honey. In this way, there are simple, simple holes inside the substance of the lungs. These are known as alveoli. And alveoli are those tiny portion inside the lungs where blood coming from the heart enters into the alveoli, and from these alveoli, blood pick up the oxygen which is coming from the respiration from the outside and goes back. So these are the alveoli are the spaces where this exchange takes place. Oxygen enters into the blood which is coming from the heart, and carbon dioxide and other gases also shed off here, which goes back from the bronchial tubes outwardly. So this is the normal procedure of working of the lungs. But if there be any problem in the alveoli, this exchange is not taking place. But there is not big chemical reaction or anything else. It's a normal procedure that oxygen is heavier than the carbon dioxide and other gases. Carbon dioxide and other gases are coming from the whole body, and they are lighter than the oxygen. So it means when you see blood enters into the alveoli and there are heavy material, light materials. Blood itself is heavy. Their cells are heavy. They remains downward and upward. These gases comes up. Whereas when the with the respiration, air goes to these alveoli, the oxygen being heavier is shedding down, going down into the alveoli, the base of the alveoli, you can say. And ultimately, the carbon dioxide and other gases which are coming from the heart goes upward automatically. There is no concern. Just like if you put some stone crystals in one bucket, and ultimately this bucket is full of water. And when you put the uh, stones in that one, automatically the water is lighter than the stones. It will go out. The same thing happened with the gases exchange. The gaseous exchange, because in the lower classes, when we were in the schools, we were doing all these experiments with the gases, how the gases are converted in the test tube into one tube to the other tube. The lighter gas, which are lighter in weight, they goes upward in the up tube, and the heavier weight gases goes to the downward tubes, even if they were vice versa before that, when you are joining these two tubes. In this way, the same thing happens in the lungs, that the heavy oxygen forcibly is pressed down and enters into the hemoglobin of the blood cells. So hemoglobin, you know that this is a part of the blood cells, but it is like an empty wagons. These are empty wagons, and the oxygen is filled into that one, and then this blood, having this hemoglobin filled with the oxygen, goes back to the stream, and wherever it has to go, and it has to supply that oxygen. It's a normal procedure. And everywhere inside the body, one important function is carried out: how the exchange in between these cell takes place. One cell has one stuff, and it has to transport to the other stuff. There's no door, as I told you in the previously, that every cell has a wall, and those walls are of peculiar nature, that they do not have any pores and doors. They do not have any pores or do, just like our skin. We see this is intact. Just like you put decoction in a sieves, and it is distilled over there. Whereas if you put in the skin, if you put any water, you take the outside skin and you put the water, it will not drain downward, because still there are holes. There's still they are known as pores of the skin. But when the pressure is exerted more inside the skin, and the things which are liquid and which can pass through the pores of the skin will go out. Same way, the sweating, the perspiration goes out from our body, means the internal pressure is increased, and with that internal pressure, this liquefaction or liquefied stuff, or the garbage which is collected by the blood from the other organs circulating inside the body, has come to the skin, and pressure has increased inside the skin cells, and ultimately that increased pressure opens the pore. It opens the pores, and that goes outside. In the same way, we are talking about the lungs. In the lungs, alveoli are dilated by the internal pressure or the gases which we termed as residual gases. One is total lung volume. That is means how much oxygen or how much gases, you can say, how much gases could be filled into a lung maximum in the breathing, how much air you can put into the lungs, that is known as lung value. And now we know how to measure it in the medical laboratories and all that. We know that how we can measure that, how much air can enter into a lung, that is the total lung capacity. And then expiration and inspiration. This is a type of air which is known as tidal air. And tidal air is the play game, you can say. We play game with the lungs and outside air, that how much when you inhale, take breathe inside, air goes inside the lungs. And when you breathe out, expiration, air goes out. And this volume of the air is known as tidal volume. And other than total lung volume and other than the tidal air volume, there is one other volume that is known as residual volume. Means even by expiration, air goes outside or the gases goes outside, but still some portion of the gases which were coming from the blood of the heart, which has been collected from the whole body, maybe carbon dioxide, maybe other gases. They are lighter than that one. And it's nature's process. Very astonishing process that that air, that is the residual air, the balance air, which is not going out, which is not coming in, residual air, though it is exchange every time. It is exchange every time. With every expiration and every inspiration, some portion of the air remains inside the lungs so that the alveoli could be dilated, could remain dilated all the time. Alveoli may remain dilated all the times so that the inspiring air can go easily into the lungs, and also the blood can enter into the alveoli, which is coming from the heart. So in this way, nature has set up this type of conditions in this way. But I'm explaining all these things because if there be any problem in this functioning, this is the function. Air from outside being heavier goes to the lungs, to goes to the alveoli. Carbon dioxide collected by the blood circulation throughout from the body is lighter than the oxygen, and it goes out. Normal procedure. So this is going on. But the residual air, nature has set up a program, nature has set up a fixed volume of the air so that the alveoli of the lungs should remain dilated all the time, so that it should be an easy function, that air can come in, air can go out. Though there is a difference. Incoming air has oxygen, outgoing air has a carbon dioxide and other gases. So this is, if there be any obstruction in this way, this will produce symptoms. This will produce pain. This will produce difficulty in breathings, and that we can note outwardly, and we can understand that what's going on inside, what's going inside the body, inside the chest. The other thing, in general, I have described 2 3 times in these lectures, that first thing, whenever anything happens, whenever anything happens abnormal inside the chest, the first thing which appears, which we notice, is the pain. Pressure, tightness, shortness of breath, and sudden swelling, sudden obstruction in the backward flow. Means blood is going to each and every organ, going to the hands, going to the feet. But when it is not possible for this blood to go back in the same stream, in the same force, then it stains, stay there, stagnation. It stays there. And when there is a extra blood stays in any of the organ, it is swelled up. It shows pressure in the arteries over there. It shows the pressure in the veins as well. And veins are superior, superficial, you can say. Veins are the blue veins you see on your hands. These are superficial. And if these veins you see superficial, these are bulging out with internal pressure or internal collection of the blood. That is why if there be problem in this exchange of circulation, exchange of gases and all that, it produces swelling, heaviness, and all these we see whenever we see this kind of conditions. We can say this is all because there is some problem in the chest. And then after that we have many other measures by which we can diagnose that this is what I will tell you time to time, if it is a lungs problem, if it's heart problems. But there are some other signs I will have to describe you here in this English lecture. Dizziness, rapid and irregular heartbeats, because normal procedure, if it's going on, there's no problem. And normal calculations we have 72 to 80 per minute is the rate of the heart that it should pump out blood, or it should relax heart and take the deoxygenated blood to come into the heart. It allows that one. So this is the normal procedure, and that has a calculation in minutes 72 to 80. This is the variations, maybe a little bit more or less, but 72 to 80 is the normal range of this thing, blood circulation. And if it's more, suppose if it's more or if it's less, we can understand that something is wrong with the heart. Or in between, obstruction, somewhere there may be any obstruction, or some bone is broken, and that bone is obstructing the way of any blood vessels. There is a swelling, there is a tumor, and that tumor is causing problem for the normal flow in the arteries and also in the veins. That will produce swelling, backlog. In this way, all these conditions are indicative that something is wrong in the heart or in the pathway of circulations. So wherever it is, we can easily identify it, we can easily recognize it, and we can treat that. If it's a outwardly external things, it's very easy to be treated. But if it's a internal thing in the heart, it is a bit difficult. Now the surgery has advanced even for the hearts, and we are able to correct those things. So whenever this kind of conditions appears, the dizziness is the other symptoms. We patients who are having this kind of problems may feel dizziness, lack of oxygen in the brain, vertigo. All these things are associated with that. And also, I have told you about the nausea, vomiting. These nausea, vomiting are the indication of, even if it's not related with the GIT, gastric and digestive system, it is not related to that one, nothing like that one, then this nausea is the indicator of uh, excitement in the 10th cranial nerve, or irritation of the 10th cranial nerve, which is responsible for maintaining the function of heart, which is responsible for maintaining the function of stomach, which is responsible for maintaining the function of the intestines, especially the appendix. In this way, this vomiting is excited because the stomach is irritated. It means the 10th cranial nerve has been excited. has been suppressed, has been in a problem. That is why there is a nauseatic tendency, dizziness, nauseatic tendency, rapid irregular pulse beat, sudden swelling in the distal part of the body. Distal means they are away from the heart. Feet are away from the heart. Hands are away from the hearts. And these are known as distal parts. So, in the swelling in the distal part indicates that the backward flow is obstructed, maybe up to heart level, maybe somewhere else in the middle of that one, so that we can diagnose later on. Now, after that, there are some physical signs, just like I told you about the swelling. This is a physical sign. You can see outside on the legs, on the face, on the fingers. Sometimes these are indicative of some problems in the circulation, and that is related to the heart. Second, I told you about the different yellowish patches on side, on the body, or on the skin, especially. These are indicative of high cholesterol and fatty type of deposition in the liver. And mostly these type of signs immediately we can see from the face of the patient who is having high cholesterol since long. He may have some yellow type of patches just under the medial canthus of the eye. This is the canthus corner of the eye, and the medial means close to the nose. So near the medial canthus of the eye, you will see these type of yellowish spots, deposition of lipids, fats in that one. That is the indicator of that inside in the whole body there is excessive collection of cholesterol. And if it is circulating inside the blood vessels, ultimately it may go to the heart, and it may block, it may deposit over there, it may cause a big damage and problems for the normal circulations. So in this way, we have to recognize outwardly if there are yellowish type of patches of the lipids on the face. So this is indicative of a cholesterol. And after that, we must know if these type of yellow spots we see on the face under the eye, we must be alert, or we must alert the patients that you can have any time heart attack, you can have any type problem of your coronary arteries, because this lipid, if it's depositing into the skin, it means this type of a fat deposition is circulating into the circulating blood, and that is why it was circulating, it has come to the skin, and skin is trying to push it hard outwardly like the sweat, but this is still not able, skin is still not able to excrete this type of lipids deposit outward, because skin's pores are tiny, fat deposition are little soft or little hard or bigger, and they are not coming out of the skin pores. So that indicates yellowish discoloration on the face under the eye, especially near the medial canthus. So if ever we see that, we can know that yes, there is excess of cholesterol, and ultimately there may be chances of heart attack. We are not astrologers, we are doctors, but we know all these things, and we can guide you that if I see your face and you have this kind of depositions on your face, we can guide you that you should take care of your cholesterol, you should take care of your body. Otherwise, if you will not, some time may come that you may have heart attack, may have coronary artery disease. So all these things can happen. Ultimately, there are more signs I will tell you, but now we are talking about these yellow spots. The third thing is the Nails. Nails are indicative of many problems inside the body. Many changes are taking place inside the body, in the organs, and in the functioning. Just like clubbing nails, just like you can see a saucer. A saucer is put inverted on a platform, and it is just like this one. And this is indicated. The nails are projected from center upward, that are known as and this clubbing nails. And these clubbing nails are indicative of some problem in the chest, maybe heart, maybe lungs. And we should be alert. If we see clubbing nails of any person, these are indicative of that some type of heart or lungs problem this person is having. And after that, suppose if a person was not coming to you previously, but suddenly you are invited to see the patients, and at that time what you see, there is a cold sweating, cold sweating on his face. He feels nauseated tendency, he feels dizziness, and sweat is coming up, though there is a winter, though there is a normal temperature, but he feels like sweating. That is known as cold sweating. So this is also indicative of insufficient oxygen supply to the brain, and the function is concerned with the heart. It is not performing its normal duty. And with this one, sighing respiration, slow or hurried breathing, irregular breathings, all these things, anything may be indicated with this one when there is a cold sweating, shortness of breath, and breathing stops. Or sometimes, if you see the pulse of the patient, it's irregular beating. Even by stethoscope, if you check on the skin and you check the beating of the heart, it will be irregular, or sometimes the missing beat. So all these things are indicative of some problems in the chest, and especially of the heart areas. Next thing, over and above this thing, if a person is having dry cough, dry, short cough, though we know that the respiration portion and the cough portion is concerned with the lungs, it is the functioning of the lungs. But dry cough persistently is coming because heart and lungs are having relation. Blood is coming to the lungs from the heart, take and exchange the oxygen and gases, and then go back again to the heart on the left side. And this is the relation in between that. But if in case of that, the fluid coming to the lungs and fluid going back to the lungs are not of equal measurements, then it will produce, it will cause a short cough, short cough. And sometimes, if it's mainly concerned with the blood circulation, that maybe there may be a blood stained, blood stained mucus may be over there, irregular heartbeat may be over there, vomiting may be over there, and sometimes there is a fluttering of heart, irregular high beating, sometimes irregular beating. Means we have a normal measurement of 72 to 80 per minute. More is also problem, less is also problem, irregularity is also problem. But when it is associated with cold sweating, dizziness, vertigo, nausea, all these things are indicating the seriousness of the condition. You have to take care of that one. In this way, all these fluttering, palpitation, fluid in the lungs, if most of the blood is not going back, retaining inside the lungs by somehow or other reasons, it's also a cause. And after that, they, you can say, unable to walk. When he is in of these conditions, he's having cold sweating over there, then how he can walk? It's unable to walk. And blurry visions. All these symptoms are the initial symptoms. In short, the heart failure, we know the main function of the lungs is just to facilitate the exchange of oxygen and other gases, and also to supply the oxygen, allow that oxygen to go into the hemoglobin of the blood entering into the lungs, and also to take out the gases which are coming by the blood from the heart to outward of the body. This is the normal function. And there is a movement. When there is any problem in this functioning, that all the contents are not going out or all the oxygen is not going inside, there is a difficulty in breathing. So we can indicate that this is all because of the lungs problem, and we can focus our attention on the lungs. And on the other side, if it's concerned with the heart, it has a chest pain, just like the angina pectoris. I have described many times in these lectures. Angina means pain. Pectoris means this area of the chest is known as pectoral area because this chest is covered by four different, you can say, muscles. Right side four, left side four, and ultimately they are joined with the ribs and also the middle bone, that is the sternum. And if ever anything happens to the internal organs, then pain is associated to this area, and that area is having major important muscles that is known as pectoral muscles. Two muscles, there are totally four muscles: serratus anterior, subscapularis. These are two muscles which are coming from back of our back, started from the scapular bone, that's the shoulder blade in the back side, started from the lateral border of this, you can say the outward border of the scapula, and then they are covering this area. Front of the chest. And two muscles originates from the sternum, covers the chest on both sides, right and left, goes back to join with the scapula. So these are known as pectoralis major, pectoralis minor. So in this way, these are four muscles which are covering, supporting the ribs, covering the chest wall. And if there be any pain, it means something directly may be related to the circulation of that one. Something may be related to the mass of these muscles. Pain may be because of excess accumulations inside the muscles. And pain may be indirectly because of the heart. There is a big congestion in the chest, and that is why the ribs are tense. And when the ribs are tense, muscles covering the upper portion of the ribs are tight. And when they are tight, ultimately it produces pain. But remember, not all the pains are associated with heart, because we have the third position, that's the mediastinum. And in the mediastinum, a major portion, a major vessel that is known as the food pipe, pharynx and esophagus, is passing from the chest. And when they are passing from this area, and there may be gas formation, there may be distension, there may be excess of acidity in this channel, in the digestive system, that may cause distension in the esophagus area. And because there is no gap, everything is packed up, no special space. So in this way, when any area or any organ, any vessels passing from the mediastinum is tense, dilated, with food, with gas, indigestion, all these things, then it will it will make tight this chest. And the tightness of the chest is also indicated by pain. Remember, these type of simple pains may go around the chest, but remember, muscles which are connected with this one, they are having their directions. And when those muscles, just like pectoralis major, pectoralis minor, goes from front of the chest to backward, passing the axilla. And the other muscles, subscapular resistance, serratus anterior, they are coming from the back of the chest, front. So in this way, if there be pain in the chest, the pain will travel from that area to the backside. That's also indicative of chest pain. Mostly people says, oh, it is referring to the shoulder, because the heart is on the left side, and mostly it is indicated that when the pain from the chest goes to the shoulder, goes to the arm, it's a heart attack. But not all the pains, because I told you the situation of the muscles over there, how the muscles are attached over there. In this way, not all the pains are associated with heart problem, because in the mediastinum, the middle portion of the chest, esophagus is passing through that one, and that may uh, radiate the gas formation, which may radiate the acidic reactions or acidic type of fluid from the stomach upward. And when it is sending this kind of conditions, ultimately it will press upon to the lungs, to the heart as well, and that will produce a pain as well. So in this way, it's not only that all the chest pains are of the heart pains, there may be anything else, that is gas formations, or sometimes the excess pressure, outward or downward, may cause pain in the chest, because the inferior vena cava, when passing from downward to upward towards the heart, it's also passing from the mediastinum. And from the mediastinum, when it passes, and if there be any obstructions, automatically it will create pains. So we have to identify all these things. How we can identify it, that it is the blood vessels, it is not the heart, it's not the lungs. So swelling, dyspnea, breathlessness, you can say, weakness, fatigue, discomfort in the chest, and heaviness in the whole body, because whole body is supplied by the food minute to minute, every minute. The circulation, the arterial circulation is supplying the food and materials to every cell. And when somehow this chain is obstructed from the heart to the tip of the finger. This is obstructed. Under those conditions, the body will feel heaviness because it's devoid of, it's not getting of food and oxygen. Heavy body, fatigue, tiredness, all these things are associated with each other. And because the normal function, everybody knows that, just like I told you about the lungs, the function of the lung is to take air from outward and send gases outward after taking the oxygen and transporting it into the hemoglobin, which is entering with the blood into the lungs from the heart. From the heart, the oxygenated blood coming from the whole body is sent to the lungs via the portal artery, pulmonary artery, and that is also known as pulmonary artery. And sometimes, if the lungs are blocked, some people are having arterial or pulmonary hypertension. Means there is a pressure in the pulmonary artery because heart is pumping blood into the pulmonary artery so that it can go easily to the lungs, but lungs are filled with fluid, or lungs are having other some thickness, or some, they are not having any open alveoli by swelling, by tumor, by any other cause, pneumonia, bronchitis, all these things can cause this kind of conditions, as the total flow of blood from the and ventricle is not going to the lungs because somehow there is a obstruction in the lungs, or there may be obstruction in the valves of the heart. That is semilunar valve, which is supplying blood from the right ventricle to the lungs. So there may be any problem in that pathway which is going to the lungs. So all these things can cause pain. All these things can cause cyanosis. All these things can cause heaviness, discomfort in the chest, blue, purple nails because they are not getting oxygen. Or I told you about the clubby fingers. Clubby fingers are also because of there is a lack of oxygen to the tissues, and the skin, and the nails are the part of the skin. Nails are the part of the skin. If we say nose becomes blue, cyanos indicates it's not getting sufficient oxygen or sufficient blood supply. Same way, when the body parts, structures becomes cyanosed, and it indicates the blood supply is restricted somehow, somewhere, and that is the indication of this one, that the blueness of the nose tip, blueness of the fingertips, or clubbing nails, and all these things are indicative of some problem in the chest. So this was the lecture and for the chest organs and their problems and the indications outwardly. Next time, in next lecture, I will describe you. Suppose if heart is failure, heart is going to be failure. Heart has problem. There are different conditions in the hearts, and they are producing the different kind of symptoms. Not always that heart is having this problem. Whatever problem is heart having, and all these symptoms are associated with that. No, there are some type of different symptoms in that one. The first of all, I can say if there is a left side of failure, there is a right side of failure, or there is you can say the congestive heart failures, congenital heart failure is also a condition. So all these things I will describe in my next lecture, one by one. If left side of the heart is failure, what sign we can see outside? If right side of the heart is failure, what sign we can see outside? If a person is having congenital heart disease by birth, having a congenital heart disease, what type of signs we can see outside from that child? And also, there is a, you can say, the congestive heart failure, CHF. That's important term used in this cardiology. CHF, congestive heart failure. So I will describe one by one the symptoms of heart problems in their different sectors. What happens in the right side, what happens in the left side, what happens when the excessive accumulation inside that one, or if a person is having congenital heart disease. What's that? What we say the congenital heart disease, I will describe it in my next lecture. Today's time is over. This is Gurdeep Singh Sandhu, your homeopathy consultant. My clinic address is 9701 Sarah and Court, Dublin, California 94568. My phone number is 408 687 1899. Email address homeomedicine at yar.com. HOMEOMEDICINE at yahoo.com. Anytime if you want to consult me for any disease at any age, you can call 408 687 1899. If you feel these lectures are beneficial to you, or you learn many things which you do not know previously about your health, about your body, please convey this message to your nearest and dearest so that they can join us on Facebook. They can come as a friendship. Gurdeep Singh Sandhu, homeopathic consultant, Facebook media, YouTube channels, and also Sabarang radio stations. You can join me anytime and download the apps in your phones. Station sabarangstation.com. This is my radio station which is running since 2012, and it has all 24-hour programs, Rangaranga programs, entertainment programs, filmy geese, Punjabi geese, all different kinds of geese, and you can listen those one. And every day from 5 to 6, I appear in your meeting. I attend you and I convey you the step by step knowledge of his body, about how this body is formed, how this body is working, if there be any problem inside the body, what you can see outside, so that from outside you can recognize that something is wrong in my body. Something is wrong in my body, so that you can correct that. So God bless you. We'll see you tomorrow, and tomorrow will be a Hindi lecture. Forever.